hunting down the culprits responsible for the Zika transmission in Asia. The mosquito-borne virus has already caused brain deformities in hundreds of babies in the Americas. Singapore is implementing a mass fumigation and information campaign to stop the same happening in Asia.
I think most important is the public must play their part to prevent the spread of the mosquito breeding. That is the key. And if the public see any place that is got bleeding, they should straight away report.
As few as 1 in 5 people get symptoms, perhaps only a fever and rash.
All the cases we have currently diagnosed, detected with Zika infections, in fact, most of them are mild. Only a minority, small proportions currently are being warded in a hospital.
But it's the effect on unborn babies that's really worrying. In Brazil, at least 1,600 babies got microcephaly, a condition that causes small brains, after their mums were infected by this strain of Zika while pregnant. There's also a risk of the Guillain-Barré syndrome. That's when an immune system attacks itself and potentially causes paralysis. Singapore is one of the world's busiest transport hubs, and many foreign workers have tested positive for Zika. A new Lancet report warns 2.6 billion people live in parts of Asia and Africa that could be at risk.
Parts of Asia, for example, India, Pakistan, Bangladesh, Indonesia, and parts of Africa, for example, Nigeria, would be at greatest risk of having the virus introduced in around the August-September timeframe. And not only would it have the greatest risk of being introduced, but that timeframe is also quite suitable such that if the virus was introduced, it could spread locally.
Indonesia is screening travelers for Zika. The US, UK, Taiwan, South Korea and Australia are advising pregnant women to avoid travel to Singapore. The city-state had its first Zika infection in May, a man who'd returned from Brazil. And there have been other Zika cases in Asia. But with a sizable number of locally transmitted cases in Singapore, there's a new urgency to stop a potential Asian outbreak. Caroline Malone, Al Jazeera.